Okay, and now it's telling me I need to verify something on the page. So give me a minute.
Okay. Facebook has added some extra steps that has caused some complexity here. Joanne, I'm gonna go ahead and let people in so they can get in. Just to let you know.
Okay.
You know.
Okay.
Welcome, everyone. We will get started in just a minute. We're still letting people in from the waiting room and getting Facebook Live going. Once I get the go ahead from Joanne, we will start.
Is everybody holding their breath? Thanks, I could hear you.
Okay, let's go ahead and get started. And I'm sure that we will have the Facebook Live up and going here shortly. So welcome, everyone. Words matter. Words change the tone, the frame, and behavior, and words can change practice. The adage of sticks and stones may break my bones, but words will never hurt me is not really true. Words can hurt, but they can also heal. Welcome to the Words Matter series, where we engage in open and authentic discussions about the impact of common terminology used in child serving systems with those that are directly affected. Our goal here is to illuminate how the terms that we use can influence someone's perception, their approach, practice, as well as explore alternative language and alternative approaches as a means of intentionally shifting how we view and interact with youth, with families, and with each other. Today, we'll be exploring the use of the terms substance abuse and addiction. But before we begin, I want to get a little bit of feedback from you. So we are going to take just a moment. I want you to consider this question. What comes to mind when you think of the term substance abuse or addiction? And I want you to use the link that Joanne's going to put in the chat box to a Mentipoll, and just put in there the thoughts, the words, the terms that come to mind when you hear this term. Let's see if we can get the Menti poll. Joanne, if you wouldn't mind dropping the link in there. You can also type in the chat box. Yes, you can do that. Okay, there we go. You want to go to menti.com and enter the code that's there in the chat box, 2290-2404. You can see it on here. As people respond to this, we'll start to see a word cloud. I see some people are putting things in the chat box, which also works. Stigma is one. There we go. We're probably familiar with word clouds, but the words that appear in the larger font are the ones that more people are putting in. So some of the things that come to mind when you hear this: shame, disease, violence, bad, broken, addicted, disordered, illness, illegal, untrustworthy, drug user. That's another term that's often used in addition to these. I'm seeing also in the chat, weakness, pain, sadness, trauma is showing up. But there in the middle, what's showing up more than anything else is stigma surrounding this and shame. A second for a few more. Problems, forgotten, misconception. Yeah. Unfixable. Ooh, that's a painful one. Escape. Okay, there's a variety of things, but we still have shame and stigma showing up more than anything else. And bad in mental health problems, trauma. Okay. Thank you for answering that. It gives us an idea of the things that pop into people's mind when they hear this terminology. So let's talk about how the use of the term substance abuse and addiction impacts youth and families. We have an amazing panel of discussants today. Two more than we usually have. We've got 4 folks with us today. We have Elise Greenemeyer, who is a youth peer specialist from Texas, who works in an intensive outpatient program for youth. We have Morgan Humberger, who is a recovery specialist in California, who focused her master's thesis on preferred terminology of youth in recovery and is in recovery herself. We have Heidi Roshan from Maryland, whose son has struggled with substance use for many years, and who is also a seasoned parent peer support provider. And we have Evan Doan. He's the Community Impact Director for Utah Support Advocates for Recovery Awareness, as well as a peer in recovery. So I want to thank all of you for being here today and for sharing your experiences and your perspectives. And Joanne is putting everybody on here so we can spotlight you as we talk. Thank you. All right, welcome everyone. Let's start with our first question. In the child and youth serving systems, we often refer to individuals using substances as abusers or addicts. And you saw some of the other terminology that popped up in the word cloud. While that terminology has been accepted under the medical model and behavioral health and anecdotally accepted, it tends to have negative connotations. And it may not be how youth and families would like to be referred to. I think in the word cloud, shame showed up, stigma showed up. So it does have that negative connotation. Those experiencing such challenges themselves, or who are supporting a child or a young person with these challenges, may define substance abuse or addiction differently based on their lived experiences in service systems and in public settings. So I want to start with Heidi. From a parent perspective, what does the term substance abuse or addiction mean to you?
Well, first thing I always think of is that it's a club that anybody can belong to, regardless of who they think they are and regardless of what they think their moral and their wherewithal is, that it can really affect anybody. Almost everybody knows somebody that they would classify in that. I think that it's really difficult for me to really say that the word abuse and use, I know that's a big thing. And as a parent, I think that some substances aren't always substances that are misused and or used, because if you asked my child, he would tell you that his substance that I say he misuses is his medicine, and it is good for him. So he would not classify it in the same way. So I think that for me, it changes over time. It's something that anytime it becomes a problem when it's getting in the way of your functioning. The terms, I would never refer to anyone as an addict. I would always use the person first language, and I would always encourage others to do that, of course. So I guess I think that dependency on something is more of a better word for me, because it could be a behavior, not just a substance. And some substances that are used, that can be misused, just because you use them doesn't mean that you're using them wrong. So
okay, yeah, dependency is another term that is more palatable and is probably the better description, when you think about it.
yeah,
Particularly for those of us that it's a way of coping. It's something we turn to maybe instead of something else. So yeah, that's true.
and I've met a lot of parents that do refer to their child as an addict. And I have met some that absolutely you cannot use that word at all. And I've used language about my own child that I've been totally attacked for, that I didn't know in other worlds I wasn't allowed to use.
Yeah.
Because he drives high to me, and high is not the word you use in impaired driving. So I've learned a lot about things that I thought were okay are not.
Yeah, that's true. It depends on, there's a cultural aspect to it. There's a community and where you're from aspect to it.
Yeah.
Yeah. So, Elise, and I'm going to ask Morgan this as well. From a young adult perspective, what does this term mean to you? And Elise, you can start, and then Morgan.
Well, first and foremost, thank you for having me here today. When I'm initially meeting with clients, I do an assessment with them. And on that assessment, we ask questions like, have you been physically, sexually abused? So just that word abuse in and of itself has a lot of negative connotations. And I'm really honored to be a person in long-term recovery. And for me, whenever somebody says like substance abuse, it is really diminishing, and it doesn't at all encompass the hope that goes along with being in recovery. So I think the language that we use is really, really important to articulate our specific experiences. And it can be harsh when you're still ambivalent. You're not sure if you struggle with any sort of substance use problems. Maybe you're not really ready to get support or services, but you're kind of being forced to, maybe by parents or primary caregivers. If someone comes at you and says, like, you're a drug addict, you're a substance abuser, it can really cause individuals to just totally shut down, and it blocks any rapport building or building any connection. So in the work that I do, I find it really empowering to allow people to classify themselves in a way that feels most appropriate for them. And I work with some people who like to share their days sober, or they like to share, I've been in recovery for this long, for 3 years, but I've been sober for 2 weeks. So I think that individual language is crucial, because everyone that struggles with substance use is very different and very, very individual and very unique. And I don't personally ever feel like it's appropriate to kind of shove a blanket label on people. But I think just shifting our language, kind of pivoting from substance abuser to a person that struggles with substance use, can really encompass the entirety of the person. Instead of having their struggles with substances be the forefront of the conversation,
Mhm.
saying a person with substance use highlights that that's one component of who they are, but maybe they're also a really great artist, and maybe they're
Mhm.
also really, really funny. They're just struggling with this certain component right now. So I think that strengths-based language is really empowering, especially with adolescents who are still trying to figure out who they are and what their place is in the world.
Mhm.
And being labeled at a young age, that can really stick with somebody and be really disempowering.
Yeah. So I mean, you bring up the fact that it is labeling, which can follow you in so many different ways. But it also is a term that's used to define a person when it's only a piece or an experience that they're going through right now. And both those are really important points. Morgan, what would you add to that? What do these terms mean to you?
Yeah,
From professional and lived experience.
yeah, I want to go back to the word cloud that everybody was contributing to. The
Mhm.
phrases that were thrown out there go along very well with, like, whenever we're using these phrases like substance abuser or addict, we're making the person's substance use their identity. And like Elise said, there's so much more to somebody's identity than what drugs they might be doing or they might be in recovery from. And while, phrases like addict do have their place in the addiction recovery realm, they're typically just within the walls of a recovery community. And so they obviously do not belong in our medical model of behavioral health. These kinds of phrases really feel the stigma and the shame and the blame that comes with using substances. And there's been studies that have shown that when we use these phrases, especially within the medical field, there's an intense decreased quality of medical care. And so if you're 17, 15, trying to get into recovery, and you have your doctor in front of you calling you an addict, you're not going to want to get care.
Yeah.
You're going to want to continue to hide and feel the shame and the blame, and it becomes your identity, which can just further the cycle and make it so that you are continuing to use even later into life. So these phrases have such importance, and I absolutely agree with Elise. Like, we need to move towards that more empowering, that like self-determination language.
Yeah, thank you, Morgan. Evan, what about from your perspective, personally and professionally, abuse or addiction? How would you define that? Or
I love what's already been said. I would add that, if we want to change the conversations that are happening around substance use in our communities, we have to start by changing the words that we use, right? And I love this quote by Don Koyas. He's a recovery advocate, and he says, words are important. If you want to care for something, you call it a flower. If you want to kill something, you call it a weed, right? So the words that I use to talk about myself, like, implicitly affect how I perceive myself, how I perceive people like me, and how people perceive people like me. And so I can shift those words that I use to make profound shifts in how people perceive me as a person. For example, I also identify as a gay man, but it would be weird for me if someone were to call me a gay, period, right? Like use that as a noun, right? See, these are adjectives that describe aspects of our identity, not the wholeness of who we are. There's this other quote that I found in research that I love that says, reducing a person to nothing more than their difficulties is one of the most damaging and dehumanizing forms of language. It denies the existence of any other facet of that person, any relevant roles or characteristics other than their diagnosis. And I think that can be profoundly harmful. And when it comes to the terms like substance abuser or addict themselves, there's been a wide body of research, and I'm sure Morgan can add to this, on those terms and how they impact people's perceptions of people with substance use disorders. And when they've studied that term substance abuser specifically, even with well-trained, like, doctorate level clinicians, they found that term substance abuser made even these like clinicians think that that person that they were talking about was way more in need of punishment, that they were more of a social threat, and that they were to blame for their condition, when Instead, when they shifted the term substance use disorder, they found that those same providers felt that that person was more in need of treatment and that they weren't necessarily to blame for what was going on. And so just that little shift in language makes a huge difference in how even like clinicians perceive these issues.
Mhm. Yes, absolutely. And I love that you guys have already talked about some of the impact that this has, not just on the group as a whole, those in the recovery community, but individually, internalizing that thing. So I'm not sure that mental health professionals give a whole lot of thought to using these terms when they're referring to youth and families with whom we work. But youth and families may feel or be affected differently depending on their situation, and definitely do react when certain terms are used. And you've even, you guys have brought up research about this. The tone of and the way in which a term is used can impact people differently and can influence how others perceive them. So you've talked a little bit about some of the impacts that research has shown, and a little bit about how it's impacted you, but talk a little bit more about the impacts you've seen or experienced based on when this more negative terminology is used. And anybody can start.
I can tell you that from my perspective. I think that the mental health field in general has worked really hard to get rid of a lot of stigma. And with substance use, I don't think it's near as far, with the exception of a couple of things like even with the term alcohol, there's a term for someone that is dependent on alcohol. They're called an alcoholic. There's no other substance that we actually have a word for that. And I think that because it's probably a legal substance that is more acceptable socially, we don't have as much stigma as that we do around other things. But I know that generally I get a very different response if I say that my son has a substance use disorder versus a mental health problem. And he has both, but I do get a very different response. And suddenly the mom that was there like helping, I'm suddenly labeled enabler automatically when you use that word. It's as if suddenly there has to be somebody to blame for that. And so that's something that I feel
for the substance use or when you use mental health
substance use.
So you get that negative response that's kind of shut down and you're looked at differently.
Right.
Well, that's interesting. But when you say mental health disorder, they're still
I think it's more
supported.
socially acceptable there because that, I mean, and it's all relative because I think that there is also a still stigma around that. But I think that we've done a better job of understanding that there is a chemical issue. And people see that as, oh, you have a mental health problem, that could be a chemical issue, where substance use, that's just morally, that's your choice. You've chosen to do that. And so I feel like that there's a little bit of more stigma around the substance use word than there is mental health anymore. And I think it's just a matter of advocacy and people getting rid of that stigma.
And I could see where it would, if that change, with, oh, that's a choice, it's something you're choosing to do, and how people may say that reflects on you as a parent. You're a bad parent, or you're not supporting, or you let that into your house. Things like that. And that can keep you from seeking services. It also shrinks your support group, doesn't it? The number of people you can talk to. So yeah. Thanks, Heidi.
The thing that's really hard is asking for help. I mean, I see this constantly just with adults. Like, it's hard to reach out to a friend and be like, hey, can I borrow something? Because a part of it is recognizing, like, I don't maybe have all the tools on my own right now. And so if you're looking at adolescents and young adults, it can be so hard to say, hey, first off, I have a problem and I need your assistance to address it. And when you go out maybe to meet with a counselor or a doctor and they use this stigmatizing language, it can cause a person to just totally shut down because you are already in a vulnerable place of maybe not feeling ready or not feeling certain about putting a voice to some of the struggles that you've had. And if you feel like you're going to be judged, it makes you not want to be vulnerable and ask for help at all. And I've worked with clients who have gone into the doctor's office, like asking for help withdrawing, for different ways that they could do it safely so that they didn't just abruptly stop taking whatever their substance of choice was. And the doctor said, like, oh, so you're a drug addict. And it leaves the person being like, I don't know, it really just breaks down the opportunity for someone to ask for help, and it keeps people stuck in their addiction. And what we know about addiction is that it's progressive, and typically it gets worse before it gets better. And so if someone is feeling bold enough to reach out for help, I think it's really important that their providers are not using stigmatizing language, that they're using language that is hopeful and empathetic, and it recognizes that this person has had struggles, but they also have a lot of positive traits that they're willing to kind of see expressed.
Yes, and you point out that it's a missed opportunity that may not come back around again. If it's language that makes people kind of shut down and brings that shame forward. Really
absolutely. And I think that language also isn't based on education, and it's not based on like the neuroscience of addiction. Maybe a part of that is that the science on addiction is still like a fairly new field, and people are kind of still learning and switching their perspective from it being a moral failing, like Heidi was saying, to it being like an imbalance in kind of your reptilian brain, in your midbrain, that you actually need external support for.
Yeah, education is a key here. Evan or Morgan, anything about the impacts that you've seen or experienced yourself when this term has been used? How it makes you feel about yourself?
Yeah, a couple of things that come to mind. I think that what we're advocating for here is to bring the language we use to talk about substance use in line with other kinds of diagnosable conditions, right? So, for example, I would never call someone who had trouble managing their weight and diet like a food abuser, right? They're people with an eating disorder, right? And so, but we have a lot easier time using that kind of language with these kind of mental health diagnoses than we have with substance use conditions, and it's for a lot of the reasons that have already been mentioned, because we moralize the issue of substance use, right? I also want to acknowledge that for a lot of people in recovery themselves, we've been to recovery meetings where the terms addict and alcoholic have been normalized. And I know that in my own experience, it took me many years to come to an acceptance of applying those terms for me. And so or applying them to myself. And so I think it's unreasonable for us to expect people in the general public to not see those terms as being inherently stigmatizing. So when I choose to talk about myself, I identify as a person in long-term recovery. And that gives me, since I started making that shift in my own language, it's profoundly affected how I see myself in relation to the broader community. And it, like Elise was saying, it kind of puts the focus on the hope, the positivity, all the things that come with recovery, is instead of just focusing on the identity of being an addict or alcoholic, which can feel very stuck.
Yeah. Morgan, I believe that your thesis had something to do with how people hearing those terms, how it impacted them.
Yeah, I wanted to finish off this question with like a lot of the research. So for my master's thesis, I conducted a quantitative study that looked at how collegiate recovery students, so these are students across the country who are in programs at their universities or community colleges that provide recovery resources. I looked at how they rated their comfortability levels with these different word choices. So I was looking at phrases like person with a substance use disorder, person in recovery, addict, alcoholic, and then other phrases we hear like clean and dirty. And I was looking at how they preferred to identify themselves, their comfortability being referred to by somebody within their recovery community, and then their comfortability being referred to by somebody outside of their recovery community. So their therapist, their doctor, even their parents. And what I found was the phrase person in recovery by far had the highest levels of comfortability. That was the one that, like, in every environment, that is what was most preferred. there was decent levels of comfortability with the phrase addict and alcoholic, but that was only shown when used as somebody identifying themselves or being referred to by somebody else within their individual recovery community. So that could be just within their 12-step or SMART recovery meeting. That could be just within their collegiate recovery community. But whenever it came to having somebody outside of their recovery community or outside of themselves refer to them as an addict or alcoholic, comfortability levels just skyrocketed down. And so this really showed that the environment matters. And so whenever we're talking about our word choices, maybe using more of those affirming languages, person in recovery, person with a substance use disorder, and then looking a lot at just the intersectionality of it all too. Women and people who identified as non-binary just overall had the least amount of comfortability with phrases like addict and alcoholic. And that could be because there's been a shift in just the recovery options available to women and non-binary people, that they might not be hearing these phrases like addict and alcoholic within their recovery communities as frequently as they were in the past, because there's just a shift in how recovery looks, with there being more pathways and more options. And then I also wanted to mention that within the study, I was looking at the way that these word choices correlated with stigma, self-compassion, and then our recovery capital. And especially whenever we're talking about young people, the study showed that individuals with 1 year or less recovery time had increased internalized stigma, which was negatively correlated to their self-compassion and their recovery capital. And one of the things that plays into that internalized stigma is the phrases that we hear and that we're told, like, you are an addict, you are an alcoholic. And so, especially with young people and especially with those early in recovery, it is super important to ask them, what phrases are you comfortable with? How do you want to be referred to? And, you know, recognizing that there's differences in environments between a meeting that they go to 6 out of the 7 days of the week or a doctor that they see once every 6 months. And so just recognizing that, like, there's research to back up that these phrases should not be used in certain environments, and then asking people, like, what is your preference? How can I help you? How can I decrease your stigma and increase your self-compassion?
Yeah. So do you guys see yourselves in some of the research that she's done, you know, when you were younger? I'm glad that we do have those type of programs at the college level, because that is a place that particularly alcohol is used, but other substances as well.
And I really like that Morgan's research kind of highlights too that there's like some sort of like appropriateness to the in-group use of the terms addict and alcoholic. Like, I know that when I hear that from somebody else in recovery, we have a basic understanding of what that means. But when I hear it from those terms from someone who's not themselves in recovery, I almost always associate it with some sort of stigma or judgment. They don't have that same understanding, that same kind of like knowledge of what that term means in group.
Yeah, I think there is an important distinction between who uses those terms and who you almost allow to use those terms, you know, because you do have that understanding between the two of you, for sure. So we've already kind of got into this a little bit, just as we've gone along, but, you know, alternative language approaches, you know, what would you recommend? What works? I mean, obviously asking, you know, we're getting in the habit now, and you see more and more people asking, you know, what pronouns would you like me to use? We've had lots of community education, using person first language, don't call someone schizophrenic. It's a person who's living with schizophrenia. So in this arena, what would you recommend that people use in different settings, in different ways? What's the best approach, you know, for yourself, for those that you work with that you've seen, you know, use? What would you like your child to be referred to? Anybody can start.
I've heard a number of panelists say this already, but I want to kind of highlight this because when I give trainings on this topic, the thing that I try to really drive home for folks is that the use of that person first language, right? And so the most respectful way of talking about any group of people generally is to talk about them as people. And when I say that, I mean to literally use the term person or people, right? So
Mhm.
person with a substance use disorder, a person in recovery. So we're really putting that word person first, and that's kind of what we mean by person first language.
Mhm. Yeah, and Evan, you, when you and I were talking, your organization changed its name and everything because
Yeah.
words matter.
Right.
Can you talk
Yes.
a little bit about that?
Absolutely. It's a great point. So we were founded as a recovery community organization in 2006, and we were initially called the Utah Substance Abuse Recovery Alliance. And then we got exposed to some of the research that's been done on language and particularly around that term substance abuse. And because it's so inherently stigmatizing, we changed our name. And so now we're the Utah Support Advocates for Recovery Awareness, which is a mouthful as well. But it was important enough to us that we wanted to make sure that we were reflecting, person first language in even the name of our organization.
Mhm. Yeah, that's a huge change, built on research and feedback. And that's not always easy to do, but it's an excellent example of
Yeah,
how
and
we
when
make it that obvious.
Yeah, when a group of people tells us, that this hurts, I think that we want to listen to them and be responsive to use the language that they prefer.
Mhm. Absolutely.
I also really like the recovery awareness piece because it's so strength-based and it's so it reminds somebody, yeah, recovery is like, let's be aware of recovery instead of addiction awareness. Let's be aware of recovery. And I think I love that.
Mhm.
Yeah, absolutely. It's hard to say like a one size fits all, like this language is better than this language because everybody is so unique and so individual. And I think that asking somebody how they prefer to be referred to really like opens the door to have a great conversation with them and to get to know that person on a different level and maybe to get them to speak about something that they're passionate about and that they really care a lot about. And, we all know that substance use is a problem, especially with the opioid epidemic going on. But I personally love the idea of using recovery focused language, like saying the word recovery. And I love SAMHSA's definition of recovery that says it's a process of change through which individuals improve their health and wellness, live self-directed lives, and strive to reach their full potential. Because that's really the part that we want to focus on is the hope and the excitement and the joy of living a life in recovery. We've focused a lot in the past, especially in our culture, on the substance use and how it negatively harms you. Like we all know about that, but let's kind of shift gears and look at the hope that's involved with it.
Mhm.
Yeah, I'm glad that we're finally starting to like open up the conversation about recovery identifiers and giving people the chance to identify their recovery for what it is for them. Because my recovery probably looks different from Elise's, probably looks different from Evan's, probably looks different from Heidi's child. Like we all have different pathways. And when we start to shift the way that we talk about this language, we're starting to shift the narrative surrounding the biased view that our society has on people who use drugs. We can start chipping away at all the stigma and the shame and the blame that comes with these phrases like abuse and addict and junkie and all this other kind of stuff that we've heard so much in the past. And we can start to focus more on that recovery oriented, like a couple of different panelists have mentioned too, like substance use is a chronic medical condition. We're not talking about diabetes the same way that we're talking about substance use though. So why? Why aren't we talking about substance use as if it was any other medical condition? Because it can impact anybody at any age from any background. And we need to start talking about it like that. We need to start shifting the way that society as a whole deals with people who have a substance use disorder or just people who are using substances in general. Because we also need to identify that not every person who is experimenting or using substances will develop a substance use disorder. A lot of times it comes with the environment that they're in, their situation, their coping skills, their support system. And so the language that we're using to talk about all of this can really help shift the way that as a society we view this. And we can start giving people who use drugs the autonomy to self-identify and have their identities respected.
Mhm. Oh, God, that's a huge point. That is a huge point. Particularly in the fact that we have overrepresentation of those that are trying to get in recovery who have dependency on substances in our brown and Black communities. And that's something, you know, you add an additional layer of stigma, an additional layer of stigma, and on and on. So it is important. I've heard all of you say you should recognize the person as a person, and that this is a piece of their life. It's not their whole identity. So hearing you say respect them for, you know, who they are, I think that that's a really big thing. Evan, I saw that you unmuted a minute ago, so.
I just also wanted to acknowledge that, you know, I love that SAMHSA definition of recovery because I wanted to recognize that historically there's been some gatekeeping that happens around that term recovery and what that means. And nowhere in the SAMHSA definition of recovery does it say that means abstinence. It's a, you know, process of change, not abstinence. And I also like the CCAR's definition of recovery. CCAR says you're a person in recovery if you say you are. And that's it, right? Like it's just a self-identifying thing. You don't have to meet some standard, but in particular, historically, that term recovery has been gatekept by largely white communities to oppress or subject the recovery of Black and brown communities to being less than or different than.
Yes, it's something that this country and our profession still struggles with, I think, for sure. What are the differences do you see when we're talking about youth and minors, and you know, what approaches are best when someone is under the age of 18 and with their parents and supporting their caregivers? What are terms that would be good to use, language, approaches?
So prior to my current role within Collegiate Recovery, I actually had the opportunity to be a substance counselor for youth at an outpatient mental health clinic. And recovery is a family event. I think a lot of us can agree on that. And a lot of times I was faced with parents who did have those stigmatizing views of what addiction and substance use disorder and all of that was. And so it required a lot of education on what does recovery look like, what can recovery be. And whenever we were talking about, you know, language that can be used, I really focused on teaching parents the importance of using that hopeful, empowering language, because if you're already in the process of getting treatment, a substance use disorder does not have to be a death sentence. Especially if you're finding recovery young, it really is about finding the supports and creating an identity in recovery. And so when it came to working with youth, it really was increasing that self-compassion, that self-reliance, increasing that support system, and having everybody on the treatment team, including the family, on board with the language that we were using, with the skills that we were teaching, and, you know, things of that nature. Because it's really hard to be, you know, 16 and in recovery when your entire household is against you in your mind. And so, yeah, shifting, even working within family structures on shifting that language to more empowering, affirming language is really important.
Thank you. Good insight. Anyone else? We do have a question in the chat box, but I wanted to give a chance. If there's anything else that you want to comment on about approaches or a language, how you'd like to be referred to. Okay. So there is a question. What are your thoughts around disorder, as in substance use disorder or co-occurring disorder, as opposed to like addiction or use or abuse or misuse, I guess?
So I think that language changes all the time, right? And then language has changed. The language that we use to talk about these issues has changed just in the time that I've been working in this field. And if I were to guess, like kind of prognosticate around what's going to change coming in the future, I would suggest that perhaps we might eventually drop the term disorder. I don't know that for sure, but disorder does feel a little bit stigmatizing to me as well. And I think that maybe we could say it's a substance use condition or something that's a little bit more neutral. Disorder sounds to me like chaos or I don't, it just doesn't feel
Mhm.
right. But we'll see what I don't know that I can accurately predict that will happen, but I think that maybe.
Mhm. Yeah, one of you brought up the diabetes, and I was just thinking in my head, yeah, we don't say that people, we may say diabetic, but that doesn't ring like alcoholic or pothead or junkie or any of those things that go along with that. There's not a stigma attached to that. It's not, oh, you're a non-sugar regulator, a non-insulin regulator. It's just not the same thing. So I can see where you're saying with disorder. I mean, we may talk about blood disorders, but we don't really do the same thing as we do with this type of mental health challenge, condition, behavioral health condition.
Yeah, I want to bring up what David had said in the chat that so this whole topic of word choice and all of that has been one of my favorite topics to talk about. I have a background in rhetoric and as well and social work. So word choice is just kind of like the natural bridge between the two. And I remember whenever I was first starting to do a lot of the research in this kind of stuff, disorder was the big hot word that we were using. Like person with a substance use disorder was just the phrase, because as David had mentioned in the chat, it was a way of moving away from it being a moral issue. And in my opinion, that phrase disorder was much more to be used within medical spaces. And so that's how we see the DSM change. Doctors are supposed to be seeing it as a medical issue. It is a medical disorder. But I think whenever we're talking about a day in the life of a person in recovery, we're not going to go around being like, I'm a person with a substance use disorder. It just doesn't feel natural.
That's me.
Yeah, it's that's not a sticker that I put on my water bottle. But that is something that I could see in notes within a medical record. And I hope eventually we do move away from that, because I think that in itself, that phrase disorder has a lot of stigma attached with it. But I will say that goes for a lot of mental health disorders as well. I think the word itself needs to change, not necessarily the word associated with substance use. And so I think that is a bigger topic for, a bigger challenge that we have just within the mental health space is what do we do about the word disorder?
Yeah, excellent point.
That's so funny because I remember, not funny, but I remember when we felt like way back when, oh, we've made such an accomplishment. We are now have a label that destigmatizes it. And we just learn, oh, maybe that wasn't as good as we thought it was. Because I didn't think about chaos. I never thought about that. But yeah, that's totally true.
I'm sure that's something that we'll continue to see is maybe we'll change the word disorder and then 20 years later it'll be oh, okay, maybe it's time for a language update. And with the word disorder, what Morgan said is exactly my experience as a clinician is we use, substance use disorder, moderate or severe or mild in clinical notes, but I never tell a client, hey, you have substance use disorder severe. If they, ask about their diagnosis, I'll walk them through the DSM criteria from a very clinical point. But for people who don't do counseling, that's not really applicable language at all. But maybe it does speak to how some of the stigma that maybe clinicians or doctors feel when they're using this word disorder.
It was just pointed out, David had a good question about culture. I'm curious what everyone's thoughts may be about ways in which culture may shape understanding of these various words and phrases. For example, I imagine that a definition of recovery for some individuals or communities may look different for others. Curious about how that language may impact the ability to receive support. For example, are there points in which word associated with recovery or recovery itself might be more white-centric? So any comments about how culture plays into this?
I mean, thinking about culture, what initially comes to my mind is movies and TV and music, like all the stuff that adolescents are really listening to that kind of glorifies and glamorizes all of this. Like it makes it seem cool and it makes it seem really, really fun. And I think that that's been something that's been delightful to see recently is more people that are in recovery and who have a spotlight on them coming out and speaking about their experience. That just goes to kind of normalize being in recovery as well.
Or you're shown as the bad person. You're the drug dealer, or you're the addict who is selling your body to get your fix. It's those, you know, it's like one or the other. It seems like what's out there.
Yeah, and something that I talk a lot with the clients that I work with is like a skill called playing the tape forward. So if you have cravings or something like that, let's look at like what's going to happen, you know, an hour or a day or a month after you initially use that substance. And what culture does is it perpetuates that glamorizing moment. So like the first couple of minutes when it feels great, but it doesn't always show the consequences, the impact on the entire family system, the struggles with self-esteem, because some of that stigma is absolutely internalized.
Mhm. Yes. So we've got about 10 minutes left. I want to do another poll in a second, but I want to give all of our panelists the opportunity. Do you have any final words? You've said some pretty powerful things that I think people are capturing as snippets that are impactful. Is there anything else you'd like to share?
I would like to add, it's been mentioned, but our word choice is an ever-changing thing. It is always going to have evolutions to it. And I think recovery does too. And I think it's important to recognize, like we did just lightly touch on culture. Recovery itself has a history of being for white men by white men.
Mm-hmm.
And the way that recovery looks now looks a lot different than it used to. We are seeing more women coming into recovery. We are seeing more people, you know, within BIPOC communities that are able to be open about their recovery. And so we might see that our word choices, our options of recovery meetings, the way that the field in general looks is going to continue changing. And so you have to be open to the change and ride the wave with the rest of us, because it's not going to look like it did in the 1980s. It's not going to look like it did in 2004, and it's not going to look like it did in 2022. It is always going to be changing, and you can't get stuck in your ways. So constantly just keep going with the research and with the way, just like the people are saying they want their recovery to look like. Embrace harm reduction, embrace our phrases and the way that we just want things to look.
Mm-hmm. Be open and listen to those
Yes.
with a lived experience.
Yes, please.
Yes. Mm-hmm. Someone said, boom, mic drop, Morgan.
I think Evan said this, but I wanted to repeat it because it really struck with me, which was give people grace if they use the wrong word. I think it was you. And I think that's so true, because I don't think that, I mean, obviously depending on what they say, but I don't think most people know, because it does change so quickly and people think they are saying the most, you know, appropriate word. They may not. I know that, you know, growing up in the family organizations for years, the word client was like a bad word. And when Elise said that, I was like, she said client, like you don't say client. They're not clients, they're people. And so, but I know that she didn't mean anything. That's what she's called them. And that's where that culture calls them. So remembering, I think I mentioned when I used the word high driving and auto accident, I totally got chewed up and spit out over using those words. And I did not mean, I just didn't know. And I actually was like, thank you so much for educating me, because I didn't know that I was offending anyone with those words. So I think that's also giving people grace and being able to help them understand why that might have affected you the way that it did, because it might not affect someone else the same way.
Important points, giving them grace, and also being willing to change your terminology if someone says, yeah, that doesn't work for me. You know, being open to that, not necessarily being offended by it, you know, but recognizing that someone may unintentionally be using a term that doesn't work for you or is offensive. to you particular.
I literally have the word accident equals crash up on my board so that I remember, because I don't want to ever say that again.
Yeah. Little reminders. Evan?
Yeah, I think that the language that we use like changes depending upon the context, right? And so like I think that we go beyond just like what's right and wrong. It's not about right and wrong. It's about what's the most effective language or words I can use in this setting, right? And so it's always kind of contextual. The other thing I'd point out too, just in kind of relation to that comment about culture, to piggyback off what Morgan was saying, is that my ability to identify myself as a person in long-term recovery is really connected pretty deeply to my privilege that I experience as a white person and as a man, right? Like people, when they hear me talk about myself as a person in long-term recovery, I don't worry about them thinking negatively about me too much, right? But that might hit a little different if I were a person of a different race or ethnicity or gender, or if I was impacted by any other intersecting marginalized identity.
Such an important point. Yes, context and recognizing that experiences are different based on where you're coming from and where you grew up and the color of your skin and all of that. Very important. Thank you guys so much for sharing your experiences, for sharing your expertise. Before we go, I want to return back to those initial perceptions and the thoughts that people had about substance abuse and addiction. I want everyone who's been listening to consider what you've heard, what you've learned during today's discussion, and then think about what are some of the things that you are committed to doing within your role to impact how substance abuse or addiction is used or not used. Again, I want you to do another Menti poll. It's a slightly different one, but using that link in the chat box and what you see on the screen, respond to that. What are some of the things that you are committed to doing to impact how this term is used? Give people a second to go to the website and just type in. Lead by example. Modeling is one of the best ways to do that. I see in the chat, supporting people, understanding. Grace, giving grace, yes. Ask questions. Use person in recovery as the preferred language. Asking the question, how would you like me to refer to what you're going through right now? Are there others? Example, stop being comfortable, fight the powers. I love it. Joanne, could you move the screen up just a little bit? Thanks. Understand the impact of our language on different cultures. Yes, that context and trying to have an understanding of someone's background and what they've dealt with, recognizing that's not the same thing that you've been through. Decrease stigma, confront stigma. Oh, I love making sure more family involvement. Absolutely. That's a key. It's a family issue. See the person. Be compassionate. Become aware. Modeling grace, humility, trauma-informed care, and language. Challenge others with kindness and persistence. These are excellent. This is the goal of this whole series, is to have people really think about how the terminology that we use can have a positive or a negative impact. And then each of us have an opportunity to make a change. So thank you for sharing that. Thank you, Joanne. I want to thank everybody for joining us today. And we hope that you'll join us next month. And we're going to continue on into our next fiscal year doing the Words Matter series. Next month, we're going to explore the use of the term youth-driven. So I hope you'll join us for that. In closing, we want to challenge you to be intentional in using terms that are more supportive and respectful of the youth and family experience and their expertise. So thank you again, and remember that words matter. Have a good rest of your day.